swelling, headache or a rash, asthma, colitis, fatigue, or gas. What will today's symptom be? My loopy life with lupus. Hi everyone, welcome to day 13 of Lupus Awareness Month. In today's video, I'm going to be talking about pregnancy and lupus because quite often people that are diagnosed with lupus are diagnosed with it in their childbearing years. So it's important to talk about the risks and things like that with pregnancy. So I'm going to just be reading from my Living Well with Lupus Facts book from Lupus Ontario. And it just says the peak incidence of lupus occurs in women in their reproductive years, ages 15 to 45. Although lupus itself usually does not affect fertility rates, pregnancy planning is an important issue for women with this disease. So I actually took part in a study last summer to do with lupus and fertility. They were trying to find out if lupus affects fertility. And so for me, my fertility is completely normal and fine. So they said I should have no issues with getting pregnant. But of course, when you have lupus, pregnancy has to be carefully planned. So this book says even as recently as the 1980s, women with lupus were often counseled not to become pregnant due to the risk of a disease flare and an increased risk of miscarriage. Approximately 20 to 25% of pregnancies in women with lupus end in a miscarriage compared to 10 to 15% of pregnancies in women without lupus. So that's a pretty big risk of miscarriage. But things, from my understanding, are improving in this area. It says research and careful treatment have made it possible for more and more women with lupus to have healthy pregnancies. Although pregnancy with lupus may still be considered high risk, most women with lupus are able to carry their babies safely to term. Planning and counseling should begin before you become pregnant. For the best chance of a healthy pregnancy, it's best to conceive when your lupus disease activity is low or in remission, or has been stable, minimally active, or in remission for 6 months prior to conception, and you are taking only medications deemed safe during pregnancy. So for example, the methotrexate I'm taking right now, which is a cancer drug, I cannot be on that if I want to get pregnant. So, because if I got pregnant while taking it, the medication would most likely abort the baby or cause like really bad defects or things like that. So there's certain medications that you have to be off of. An evaluation prior to pregnancy should consist of both the clinical and laboratory review so that your doctor has a baseline against which your lupus during pregnancy can be compared. This is especially important if you have a history of major organ disease such as kidney involvement, since the normal values for laboratory measurements are different during pregnancy. This baseline is important for the interpretation of later results. In particular, the anti-Ro antibody, which you should be tested for in your pre-pregnancy assessment, has been associated with heart rhythm disturbances in babies of mothers carrying this antibody. About a quarter of women with lupus have this antibody. It is linked with Sjogren's syndrome and may also be seen in people with autoimmune diseases. Keep in mind that the risk of any problem occurring is only about 3%. And Sjogren's syndrome is something that a lot of lupus patients end up with, and that is dry eyes, dry mouth, things like that. You can also get vaginal dryness and things of that nature. I have never been diagnosed with Sjogren's syndrome, but anytime I have my eye exams, I've been told that I do have dry eyes, and I do feel it a lot, that my eyes feel really gritty sometimes, or just like they burn. And so I have artificial tears, eye drops that I should be using probably more than I do, but I tend to forget until they're like really bad and bothering me. I also experience a lot of dry mouth, but I think it's more linked to my sleeping pill. The sleeping pill can cause dry mouth. But I did have dry mouth before being on the sleeping pill, just not as bad. It's just worse, I guess, because of the sleeping pill. So I have a mouthwash that I use every day. It's called Biotin, and it's supposed to help moisturize your mouth. I don't know if it really helps me a lot. I think I should be using it more than twice a day. But it's like a really big bottle, like, so for me to bring it to work would be annoying. Anyways, for most women, it is extremely important that the lupus be carefully monitored by an experienced multidisciplinary team so that abnormalities during pregnancy and postpartum are identified, diagnosed, and treated promptly. For some patients, delivery must be planned at a hospital that can accommodate a high-risk patient and provide the specialized care that the patient and baby may need. One problem that can affect your pregnancy is the development of a lupus flare, and in general, it is uncertain to what extent flares are caused by pregnancy. Flares that do develop often occur during the first or second trimester or during the first few months after delivery. Most flares are mild and can be managed with small doses of corticosteroid. I have heard of like some women having very bad flares after pregnancy, and in fact, I've actually heard of some women that got diagnosed with lupus after having a baby because just the hormones and stuff, like they said, hormones can play a part in triggering lupus, and so some women that were completely healthy before pregnancy will all of a sudden go into a lupus flare after they give birth, and then they're diagnosed with lupus. So it does have a role. There's neonatal lupus. Babies born to women with lupus have no greater chance of birth defects than babies born to women without lupus. However, mothers with anti-Ro antibodies but no other antibodies are at risk to deliver a child with neonatal lupus. The most common presentation of neonatal lupus is an abnormal liver function test, a low platelet count, or white blood cell count. Most of these children do not have any problems. In most cases, these abnormalities in children will resolve by 6 months of age. However, it is important to know about the low white cell count because if the baby gets sick and has a blood test, the baby's doctor may be concerned about the low count or abnormal liver tests if they are not aware of this association. The next most common feature is a skin rash, which tends to be around the eyes but can occur on any part of the body. The rash tends to be circular and is not usually a malar rash, which malar rash is the butterfly rash. This usually occurs between ages 6 to 12 weeks, but may be present at birth and occurs in 5 to 10% of mothers with the anti-Ro antibodies. The most serious problem is congenital heart block, abnormally slow heart rate, and this may be a significant problem. Luckily, it only occurs in about 1 to 2% of mothers with lupus and anti-Ro antibodies. This condition is permanent, but can be easily treated with a pacemaker. This is the reason that pregnant women with anti-Ro antibodies should have serial fetal echocardiograms throughout the pregnancy. And lastly, children born to mothers with anti-Ro antibodies may have a slightly larger head and should be monitored. However, it rarely, if ever, causes any problems. So the next thing is about planning your pregnancy. Awareness, monitoring, and careful planning are the keys to a successful pregnancy. Before conceiving, discuss your decision with your doctor, as certain drugs should be discontinued prior to conception. Both you and your doctor should be satisfied that your lupus is under good control or in remission. If your rheumatologist advises it, select an obstetrician who has experience managing high-risk pregnancies and is associated with a hospital that specializes in high-risk deliveries and has the facilities to care for a newborn with special needs. Review your work and activity schedule and be prepared to make changes if you are not feeling well or need more rest. Consider your financial status. If you work outside the home, your pregnancy and motherhood could affect your ability to work. Develop a plan for help at home during the pregnancy and after the baby is born. Motherhood can be overwhelming and tiring, and even more so for women with lupus. Although most women with lupus do well, some may become ill and find it difficult to care for their child. This is one of the concerns that I have in terms of trying to decide whether or not to have a baby. I mean, it's been my lifelong dream to be a mom, and I want to have a baby, but there's so many factors to think about, and Alex is very worried about what could happen if I get pregnant. And then also, like they just said, you know, you have to think of the financial status. And, you know, at this point, we really, you know, we don't have the space for a child where we live. And it's been hard to save up the money. I mean, we are saving every month. We are saving money, which is good, to get a house. But it's just, it's hard to think about purchasing a house, even if we had a down payment, just because of the instability of my work right now, because it seems like the best work for me is part-time, and that doesn't exactly bring in a large amount of income. And also, even if I was working full-time, like being a nanny is never a permanent job. It's always changing. You know, the children grow up and then you're no longer needed and you have to find another job. So it's just, the financial part of it is really difficult, but then also the health part of it is a really difficult thing to think about. So I don't know, I really want to have a baby, but these are things that we have to consider. So other possible complications, pregnant women with lupus, especially those taking corticosteroids, are also likely to develop pregnancy-induced high blood pressure, gestational diabetes, and kidney complications. Problems may include excessive weight gain, generalized swelling, excess protein in the urine, severe headaches, and visual disturbances. Such developments may indicate a serious condition that requires immediate treatment, and usually including delivery of the infant. In terms of breastfeeding, most medical professionals feel that it is important to try to breastfeed your baby, as it is the ideal low-cost way to provide nutrition in the first weeks or months of life. It takes time for mothers and babies to learn how to breastfeed, and it may take a few weeks to adjust. Because breastfeeding is often a challenge, ask your doctor or nurse for help as soon as you are admitted to the maternity ward so that you do not become discouraged. Some individuals hire a lactation consultant. The staff on the maternity ward where you deliver can discuss this with you. Sometimes, though, breastfeeding may be difficult for the following reasons. A premature baby may not be able to suck adequately. Feeding your baby through a tube at first and then by bottle may be necessary. However, you may still be able to pump your breast milk for your baby. If you're taking corticosteroids, you may not be able to produce enough milk. Some medications can pass through your breast milk to your baby, so talk to your doctor about whether or not breastfeeding is safe with the medications you're taking. Because breastfed babies tend to eat more frequently than do bottle-fed infants, breastfeeding can be very tiring. Options include pumping breast milk so that a partner can help feed the baby by bottle, supplementing breastfeeding with formula, or switching to a bottle and formula entirely. Keep in mind that depending on what type of formula you use, bottle feeding can be as time-consuming as breastfeeding, or even more so if one considers the time required for preparation, cleaning bottles, etc. So be confident with whatever method you choose to feed your baby. It will be the right decision for everyone concerned. Caring for yourself during pregnancy is very important when you have lupus. You need to keep all of your appointments with your primary doctor and your obstetrician. Get enough rest, plan for a good night's sleep, and rest periods throughout the day. Eat a sensible, well-balanced diet. Avoid excessive weight gain. Have your obstetrician refer you to a registered dietitian if necessary. Take your medications as prescribed, and your doctor may have to stop some medications or start or continue others. Don't smoke or drink alcoholic beverages, which I think is a given for anyone, not just lupus patients. If you're not already taking a folic acid supplement, now is the time to start. Folic acid reduces the risk of neural tube birth defects. The most crucial time for fetal development occurs between 5 and 12 weeks. So you should start taking folic acid before you become pregnant and continue at least to the end of the first trimester. Prenatal multivitamins contain the necessary amount of folate. Be sure your doctor reviews with you the normal body changes that occur during pregnancy. Some of these changes, such as extreme fatigue, may be similar to those that occur with a lupus flare, and although it is up to the doctor to determine whether the changes are normal or represent the development of a flare, you must be familiar with them so that you can report them as soon as they occur. If you're not sure about a problem or begin to notice a change in the way you feel, talk to your doctor right away. Ask your doctor about participating in childbirth preparation and parenting classes. Although you have lupus, you have the same needs as any other new mother-to-be. And then they talk about the drugs that are considered safe to take during pregnancy. And there is hairpin, tacrolimus. I'm not sure. Some of these medications I've never heard of. Cyclosporin, azaprine, hydroxychloroquine, prednisone, and the anti-inflammatory drugs until 28 to 32 weeks gestation. Anti-inflammatories until 28 to 32 weeks gestation. Aspirin, 20 milligrams daily, and acetaminophen. And quite often with lupus, they will put you on aspirin during the pregnancy because you're also at risk of blood clots a lot of the times with lupus. So, and that can cause miscarriages and stuff. Potential complications during pregnancy: lupus flare, increased pain, morning stiffness, fever, development of a rash that worsens, stomach discomfort, nausea, headaches, and dizziness. Pregnancy-induced hypertension, mild, has a blood pressure 140/90 and over during the second half of the pregnancy, excess protein in the urine. There's a risk of preeclampsia, eclampsia, miscarriage, and then of course the neonatal lupus. So that's pretty much it. For some reason, I don't know if they mentioned it in here, but there is also the risk of babies being born with a low birth weight or being born premature when you have lupus. So those are some other risks as well. I'm in a Facebook group for women who are either pregnant with lupus, pregnant and they have lupus, or, they have lupus and they're thinking of becoming pregnant. And a lot of them recently that have been having babies, quite a few of them I've noticed have had their baby premature. So that is something else that, is a possible risk. So I hope that this video gave you a little bit more information about pregnancy and lupus. If you have lupus and you're thinking of becoming pregnant but you weren't really sure about it, definitely talk to your doctor. And like for me, I'm on birth control. There's no way I'm going to get pregnant without carefully and safely planning it out. So definitely when you know, have lupus, you should definitely be on birth control until it's, you know, discussed with your doctor that it's safe to try and conceive. So I just hope that I will be able to have a child one day. And you know, it's so funny, like years and years ago, before all of this started, when I was really healthy, you know, many years ago, I had always dreamed of having 4 children. And then as I got a little bit older and realized like the financial side of things and things like that, then I kind of like settled on, okay, I'd like to have at least 2 children. But now that I have lupus and now that I'm sick and, you know, I'm a nanny, I work with children, I've kind of gotten a taste of what it would be like, especially in this last year, a good taste of what it would be like to be a mom with an infant while having lupus. And I definitely, you know, I definitely know that if we do have a child, we will only have one, because I know that if I have any more than one, it will be more than I can handle. I've kind of come to the conclusion of what I can handle at this point, and I would just be happy with one. So it's funny how things change, but I just hope and pray for at least one. I just hope things improve soon so that we can actually find a bigger place to move into, because that's the main step. The main goal is to get into a bigger place, preferably a house where I could, my goal is to set up a little preschool in the basement that I would teach kids, almost like a pre-kindergarten kind of thing. That's my goal, because I know I can manage that, and because it would only be, the program that I'd be doing would be, I'm trying to think, it would be like it would be like a 2.5 hour class in the morning, and then another group of kids in the afternoon for 2.5 hours. And there would be like a break for me in between. And I know that I would be able to handle that, definitely. So that's definitely where I'm at right now. If we can get into there, I know that doing that will be financially stable for us. And once we can have that in place, that would be great, because then we know we'd be able to afford having a child. And then we would have to really think about the medical parts, and it's just a big thing. It's a big thing to think about. But anyways, I hope you enjoyed this video. I hope you took away something from it. And just don't forget to check out the links in the description below. Like I said, I'm doing the walk for lupus on May 31st, and it would really mean a lot to me if you guys would sponsor me. It's a secure donation page set up through Lupus Ontario, so the donations go straight to Lupus Ontario when you go on the website. So I will put that link below if you want to sponsor me, or you can purchase a handmade lupus awareness bracelet for $10 plus shipping. Or there's the t-shirts. All of our t-shirts proceeds go to Lupus Ontario for the month of May. So check those links out below. Don't forget to watch yesterday's video if you haven't. And thanks so much for watching, guys. And don't forget to subscribe if you're new and you enjoyed my videos. All right, guys. See you in the next video. Bye.